Hi there, everybody. So, Dr. Steve here with Kineci, and this is part 2 of your Understanding Your Pain. We're talking about knees and an MCL strain of the medial collateral ligament. You tweaked your knee, you sprained it, it's sore on the inside. One of the things that often happens is it'll be sore and tender and swollen, especially if it's a true MCL, because that structure, that ligament is outside the joint capsule, so it would be extra capsular swelling, meaning very often it'll be puffy and you can see it, you can feel it, and it's sore, being different than intracapsular swelling, which is inside the knee capsule, and that's something a little bit different. But if the MCL is strained on the inside ligament of the knee, very often you'll be able to see and feel the swelling a lot more. So as we are going on our path of healing and recovering for what to do about this, in part 1 we started with some half bridges and some bridges to put you in a protected position and get things moving. Now we're going to start to stretch out a little bit of the hips, the inner and the outer parts. You might have heard me say this before, but hips and knees are next door neighbors and BFFs. The hips and the ankles are also BFFs because they all go together, and the knee really, it's stuck in between with nowhere to hide. So it really has to deal with everything going on above and below. So what we're going to do is a side of the body stretch, and so we call this one the opposite side lateral chain stretch, or the easy term is the banana stretch. So next to a wall, we're going to have the foot closest to the wall cross over in front. The outside hand comes and hangs on to the wall. So the idea is now the body is in this big banana curve position. And what we're going to do is take the hips and do the 3 directions that we do very often. We do our forward and back here. We're going to go side to side with the hips. And then we're going to do some twisting. And as you twist, you're kind of looking under your armpit, turning into the wall and then away. So this really targets the outer part of the leg, down the IT band, down to that LCL. So this is a slightly more indirect way that we're working on the knee, but we're stretching through the hips and understanding that the strain is on the inside. Now we want to be careful, but we're going to go after a groin stretch that's going to be stretching through those parts. We just want to listen to the parts along the way. And so we're going to use a chair and a doorway here. So the little post kind of serves as the doorway for me. But what we're going to do is the bottom foot is turned out 90 degrees. The front foot is going up onto the chair. Your shoulders are oriented towards that front leg. So what that's going to do is that's going to give you a little bit more of a stretch down the inner part of the thigh, the groin, into that MCL. And this is where you just want to be careful and listen to the body as we go along. But here we're going to do our motions with the pelvis, forward and back. Hopefully a stationary chair, not a rolling or sliding chair. And then we're going to do the side to side. And then we'll go in circles both ways. And what I'll do is give you just a little bit of a visual from this other angle. So bottom foot is turned out 90 degrees. Front foot is onto the little step there, or the chair. Here as if I'm hanging on to another door jamb, but I'm going to just hang on to myself. And then we take the body, we do the forward and back here. We do the side to side. And then we'll go in circles both ways. And that will be a stretch for the outer part of the hips and the inner part of the hips, but that's getting down kind of the outer part of the knee and the inner part of the knee. So we're getting parts moving. We want to listen to the body not make things painful above a 3 out of 10, but we want to keep things moving and keep your body going in a healing direction. So this was part 2. Be sure to tune into part 3, where we're going to take it a little more dynamic, and then we're going to turn it into some lunging and stepping patterns, but in some specific directions to protect that MCL as we go. So if you or anybody that you know are having any knee pain, send them in. Let us help. Let's figure out what's going on and come up with a plan specific for that knee and that person to help them reclaim confidence and comfort doing the things that they love to do. So until next time, keep moving, everybody.